I didn't know anything about insurance, but I took a class to get licensed, and the more I learned about it, the more I was really into it. A lot of people were asking me about health insurance, and I didn't know anything about health insurance at the time. So I said to myself, I think health insurance is the market I need to go for.
There's a lot of specific knowledge when you're in the insurance business. There's so many avenues of insurance. You can't be a generalist. There's a lot of confusing part of when signing up for Medicare.
I get overwhelmed with the information and the rules that Medicare have to do for these citizens. So I can understand somebody that's not in the business could get overwhelmed. If you have family members, especially kids, children, please just be on top of what the rules are.
All too often, the things that seniors have to deal with are so complicated.
If you don't, you go out of the network doctor, you're going to pay more. That's where supplement comes in.
Sometimes you don't skimp when it comes to your health.
Yeah, of course.
Welcome to the Unlocking Senior Resources podcast by Leave the Key. I'm Larry Wagner, and I've spent 30 years working with seniors, where I was a certified senior advisor, and the last 15 years in the home buying industry as a certified senior transition specialist, where I specialize in dealing with seniors going through a transition in their lives. This podcast is for seniors, those with seniors they love, and people who work in the senior community. In each episode, we bring on a guest who works to improve the lives of seniors. This podcast is your key to unlocking senior resources. Welcome. Today we're here with Pierre Menard, who is an insurance broker who focuses on Medicare insurance. Welcome, Pierre.
Oh, well, thank you for having me, Larry. How you doing?
I'm doing very well, and thank
Good.
you. So I've spoken to other people who do get involved in Medicare insurance, but why don't you explain your journey, how you got to doing this?
Well, I've been in insurance business for about 20 years. It's this year, 2006. So I started out in life insurance. So this is actually my second career. I was actually in media sales before.
Oh.
And then, unfortunately, that company went out of business. So I was kind of floating around for a little bit. And then I had an opportunity to work for a company called New York Life. I didn't know anything about insurance, but I took a class to get licensed. And the more I learned about it, the more I was really into it. And I felt like I could really help people with insurances. And there's a lot of things I didn't know about it that I say, this is useful. And the first people I thought was my family, my friends. I was like, you know what? I think people should have this knowledge regarding life insurance. And then I worked there for about 3 years. And then I was actually did insurance for a nonprofit company in Harlem. And through that nonprofit, I was telling them about how to get life insurance through their job, and they could take it with them when they leave. But a lot of people were asking me about health insurance, and I didn't know anything about health insurance at the time. So I said to myself, I think health insurance is the market I need to go for. So then I left New York Life, and then I started working for a company that does insurance for businesses. But that wasn't enough for me, and then I got into Medicaid. I worked for a company that did Medicaid insurance. So I was working in certain areas that people really need Medicaid, and then from there, I worked for a company that did Medicare insurance, and I've been doing it ever since about 2012. So it was
just focused on Medicare since 2012.
just from Medicare in 2012.
I started 14 years ago.
So I did Medicaid for about a year, 14 years, 14 years, and then in 2012 to 13. I started working in Medicare, and I've been doing it ever since.
Wow. Funny, your background's not that different than mine. It's very similar in that I had a business. I sold the business. I joined my father in the insurance business. And same thing, he did life insurance. That wasn't my specialty, so it wasn't my interest. I got involved in doing financial planning and so on, and we've been into a full financial advisory business. But we got involved in everything but health insurance.
Yep.
I didn't want to get involved in health insurance. We sold one health insurance plan to one person once because he begged us to. We had someone write it up for us because we knew nothing about it. There's a lot of specific knowledge when you're in the insurance business. There's so many avenues of insurance. You can't be a generalist and be really good.
Yes.
So you're not only focusing on health insurance, but that you're focusing on Medicare insurance within the health insurance universe.
Exactly. Yes.
So you're in a subset of a subset to make you a true specialist.
Absolutely.
So
yes.
that gives you that. I think that's important for people to understand. Someone who just does everything and sells this doesn't have the same level of knowledge.
Yeah, and they can't educate properly.
Correct.
Because,
Correct.
there's specific questions that people have to know that probably a person who's pretty broad about it won't be able to help them or answer.
That makes sense.
Yeah.
And the rules keep changing.
Yes.
So if you're not really, like me, if health insurance rules changed, I wouldn't have known because I didn't get involved with it.
Yeah.
So if something changed that one plan, there was something better, I wouldn't have known. I wasn't really qualified, but the person really pushed me to do it. So I said, all right. So I did it, but it wasn't in my comfort zone. So I appreciate the fact that you've become a specialist within a specialty.
Yes, absolutely.
So there's so many questions because I'm 68, a newly minted 68-year-old, and I went on Medicare 3 years ago. So I know there's a lot of specific rules and things people have to know about Medicare that's so specific that if they don't do it, it haunts them. So it seemed like a great first question. What's the most expensive mistake people make when dealing with Medicare?
Well, I'll answer this to say once a person qualifies for Medicare at 65, they put in 10 years of taxes.
Right.
And they get Part A, and there's two parts, Part A and Part B. And there's also a Part D, which is a separate prescription drug plan. Right. Now, the state says if you don't apply for Part D right away, you're going to get penalized 1% of every month that you don't do it. So a lot of people would say, well, I don't take prescription drugs. So let's say you're 65 and you have the Part A and B and you get a plan without a prescription drug plan, you wait 5 years. And at 70 years old, you started taking prescription drug medication.
That's a lot of months.
Yeah. So that's 12% a year.
Right, 60%.
And but that 60% never goes away.
Ever.
So no matter what plan you go with and you have a drug plan, you're going to have that 60% or let's say 12 months.
12 months, you said 5 years in that example.
Yeah, exactly.
Yeah.
And that's going to cost.
Right.
So no matter what, even if you get a least expensive prescription drug medication, that 60% is always going to haunt you.
Right.
So people got to be very, very careful to understand that sometimes there's no flexibility. Right. Even if your personal interests say, well, I don't need drugs, I don't take drugs, I haven't taken drugs for 20 years, there's going to be a time. I'm 54 years old. I'm dating myself. But I'll be 55 in a couple months, though. But I take prescription drug medications. I've been taking it for 10 years. So if you're 65, you're going to take some kind of medication.
Most likely.
So be careful, because drug medication, that's another conversation we can have, is going to get more and more expensive. You don't want that 1% every month. And so that's the most expensive mistake that people make. So, and I had a person actually make that. I was signing up somebody my first year, and they never had a drug plan for 12 months.
Right.
And I had to do the calculation. I said, unfortunately, you got 12% that I can't help you with. And, this woman wasn't wealthy. She wasn't, she was a working class woman that worked harder for her money, and that 12% means a lot to her. And unfortunately, I wasn't able to help her. So that's one example.
No one can help her.
Yeah, exactly.
Well, let me question, no one can help her. Is there any way to petition to get that waived, or that's it?
That's pretty much it. I mean, maybe there's certain circumstances that it may be waived, but it's very unlikely.
Right.
Yeah. So
because I heard it's basically chosen in stone, but
yeah.
Yep.
Mm-hmm.
And the shame of it is, and I've said this before on this podcast, this is unlocking senior resources with dealing with senior citizens. So the podcast is about seniors, that all too often the things that seniors have to deal with are so complicated.
Yeah.
As their capacity starts to diminish. Now, 65, you're not old, being that I'm 68. I'm not old. So, but you're getting older than you were when you were 64, 63, and 52 and 53. Yeah. And we know brain cells regenerate at a low rate or deteriorate over time. So why do they make life, they meaning the government, so complicated as we get older? And it frustrates me. It seems counterintuitive that they would impose on a senior citizen a penalty that lasts forever.
Yeah. I think, well, information, I've been doing this again since 2012. Yeah. So I get overwhelmed with the information and the rules that Medicare have to do for these citizens. So I can understand somebody that's not in the business could get overwhelmed. This is where I tell people, look, if you have family members, especially kids, children, please just be on top of what the rules are, because a person by herself, a woman who's elder, older people may be overwhelmed. They get confused because there's so much information thrown at them. It's one basic thing. You qualify for Medicare. What can I get with this Medicare plan? You get Part A. You get Part A that allows you, that pays for the hospital, pays for hospice. Unfortunately, my dad had to use that Part A to go into hospice. So, and it's free. They don't pay for it.
Right.
And it actually covers home. We talked about that, home care, long-term care that's covered by Part A. Part B allows you to go to the doctors, lab work, blood tests, things like that. There's a premium that comes with Part B. That's what you have to know. Mm-hmm. When you have Medicare, but when you have straight Medicare, you only cover 80%. This is when you get all the advertisements, you get letters, because in the system they know you're going to turn 65.
Yep.
So certain companies are going to send you information. Well, AARP, you turn 65 in a month. This is what you should know. This is what you can get. And from there, you can get the other 20% have full 100% coverage. So that's the first thing. So you have to understand what Medicare does by itself once you earn it. So, and people say, well, I don't need Medicare because I already have a plan through my job. Great. We don't want to touch that. If you're retired and your company decides to cover you after you retired, keep it. Because as long as you have the most important thing that the state wants you to know, if you have access to prescription drug medication, you have access to a doctor and your specialist, and you can get blood tests and you get these checkups anytime you want. It's all about preventative care. So if you're already a plan, whether it's planned through your job or through your spouse, don't pay for that Part B. You don't need it. Just have it with you because you already earned it. So that's the most important thing you have to understand. So if you have options, and sometimes the options is not through a Medicare company. It might be through your spouse or through your job. Just compare and contrast what Medicare is offering compared to what you have.
Right.
Because sometimes when you retire, the coverage that you get from your job after you retire might not be as much as when you work for them. It might be less. And always look for the doctor, and you might not be able to use the same doctor that you had before. So, and let's say you have to see a cardiologist that doesn't take the plan that you have through your job. Look for other options.
Yep.
But always compare what's right for you. I say Medicare plans are like fingerprints. It's tailor-made for that particular person. So don't compare it to your neighbors. Don't compare it to your brothers and sisters or whoever. They have this plan. That doesn't mean that plan is right for you.
That's very well said. Mm-hmm. Very well said. Oh, Bill bought this. I'm going to buy. Bill's a year older than me. He did all his homework. It's going to save me all the trouble.
Yeah.
Don't do that.
Don't do that.
Okay.
Don't do that.
Bill's wife's a school teacher, and you didn't know that. He signed up for nothing.
The first thing I ask is, Bill's a licensed insurance agent? No. So don't listen to him.
Right. So don't listen. Don't listen to him. And you don't know how smart Bill really is, anyway.
Exactly.
That's very good. So, question. I have two questions I want to go through, but I'm going to ask this one first. So you mentioned Part A, Part B, Part D for drugs. And so Part A, you said, is hospitals?
Hospitals and hospice care.
And hospice care.
And long-term care.
And Part B is for doctors?
Doctors, blood tests, lab work, things like that, yeah.
There is no C. Is there a C or unused C?
No, okay. So you have A, B, and D.
D, I know, is D is the easier one to remember.
Yeah.
D for drugs.
D's for drugs. Exactly, that's easy. Yes. And Part C is part of an Advantage plan.
I got it. Okay.
So
that's the really confusing part.
Exactly. So an Advantage plan is a package. Right. So it includes Part A.
I'm going to rephrase this question. Yeah. I'm going to say, what's the most confusing part when signing up for Medicare? Go ahead.
It's that. Exactly. Yeah. They don't know the difference between an Advantage plan and a supplement plan. I'll explain that. So they don't know what Part C. What's Part C mean? Okay. So Part C means you have A, B, and D in one package. So that means you have prescription drug medication, you have hospital stays, you have lab work, blood tests, and you have prescription drugs in that package. So you don't have to get a separate Part D plan because it's already in that package. So, but certain Advantage plans, it depends. There's different categories. Some come with a premium, Some don't come with a premium, but the whole point of a package is usually more often than a supplemental plan is less expensive. The reason why is you have to choose the doctors and the specialists in the hospitals that are contracted with that particular plan. If not, if you go out of what we call in-network, you have to use in-network doctors. If you don't, you go out of the network doctor, you're going to pay more. That's where supplement comes in. Supplements are expensive, comes with the premium. I'm not going to say expensive. They're
Additional costs.
They're additional costs. They usually come with a premium, but you have that flexibility to see pretty much any doctor, in or outside, and they don't go by network or in-network.
So if you're you get your supplement plan, you're seeing a doctor that's out of network. Mm-hmm. So the supplement plan pays the portion that wasn't paid by Medicare?
But they have a larger provider list where a doctor doesn't have to be in that network for you to take because you're paying for a supplement.
Right.
So they don't have to. So it doesn't matter if that doctor's in and out of network. They don't work by networks. They just work by you can see any doctor with this particular plan. If you go with an Advantage plan, you have to go through that list of doctors that the doctors take and they have to be contracted with. So a lot of times, in my case, when I have a member that has, let's say, a cardiologist, my cardiologist is not in network, I would try to get, and they want the Advantage plan. That plan is right for them. The only thing I can do at that point is try to get that cardiologist in network.
Right.
So, that decision comes from the doctors. They have to agree to the benefits that particular company is offering them. They can say yes or no. That's the difference. When you're dealing with a supplement, they have to take them. Unless it's an emergency. A doctor has to see you no matter what plan you have if it's an emergency.
I didn't know that.
Yep.
I like to say I learned something new on this podcast. I'll make another comment to people, and this goes back decades. I had surgery done, and I got the bill for the surgery. It goes back decades. The surgery was $5,000. So it goes back decades.
Sure, yeah.
The reasonable customary was $4,000. So I went back to my doctor. I said, you're charging $5,000. I'm going to be out of pocket because reasonable customary. He was out of network for my plan, for my wife's plan. She was a school teacher, but he was the best at this very specific procedure. So sometimes you don't skimp when it comes to your health.
Yeah, of course.
And so anyway, I said, is this something you can do? I spoke to the office manager, and she said, no. And she gave a whole bunch of reasons why. And I said, I really appreciate it. She said, talk to the doctor. So I then wanted to see the doctor. I spoke to him before I saw the doctor. And he goes, yeah, no problem. Just tell so-and-so to knock the bill down to $4,000. So, but sometimes just because the bill is higher than you want to be and it's going to cost you money, doesn't mean you can't talk to the doctor.
No, yeah, absolutely. Yeah. If there's a situation where the doctor say, okay, it's his practice. He's going to control it. If it comes to coverage, if there's a certain, I'm glad you brought this up because, there's certain coverage. If you have a bill from, and you thought that the plan that you have was supposed to cover it, you can always appeal it.
Right.
You can always fight it. There's always that option. So even if the doctor doesn't, if even in that case the doctor said yes. Right. If other cases, no, you have to come out of pocket because it wasn't. I thought it was covered. I was explained that this was covered, and it's not. You're billing him for it. More often than not, it's a mistake, but at the same time, you have the right to appeal.
Yep.
But people should know that when doctors or doctors' offices, sometimes they especially doctors, they don't really know about the coverage. That goes to the office managers. The office manager more often knows about the coverage than the doctor does. Doctor has to do his job.
Absolutely. He's doctoring.
He's doctoring. He's busy. The office manager is the business person that deals with the insurances. Mm-hmm. So if you have questions about your insurance, don't go to the doctor. Go to the office manager.
Yes.
And you'll get a better answer.
Right. I went to her first. Yeah. And she was sticking to her guns. So and she said, if you want to go further, talk to the doctor.
Yeah.
And he was a doctor without borders. So the man spends a lot of time doing charity work. By the way, he was 80 years old at the time and doing surgery on me. His hand shook a little bit, but he was all right.
Oh, well, you're still here. So he did something right.
He did something right. But anyway, actually I used him twice for the same surgery.
Wow.
That's another story. But no, and he's since retired. But probably not even a year. He's probably gone. He would be probably over 100 today.
Whoa.
So, definitely. But with that in mind, so yes, everything in your life that be proactive in your life. That's a good moral for anything. Yeah. Mm-hmm. And you talk to most people, you say, I'm going to negotiate with my doctor, and they would say, you can't do that. A apparently I saved myself $1,000.
You can.
So I asked a question to 2 people and I saved $1,000.
Yeah.
That's $500 per question. That's a good deal.
There you go. It's not bad, right?
Think how many questions I'm going to ask you today, and if I get $500 each one of those questions, I'll be doing all right.
Yeah.
So anyway, so with that, so Medicare is confusing.
Yes.
Medicare you get when you're 65. So Medicare we talk about the A, B,
And
D,
D.
and then we talk about the
Advantage
Advantage
plans.
supplement.
Yes. So there's 2 ways you get Medicare. You know, obviously you turn 65, but you have to put 10 years of taxes.
That's important to know.
Yes. So 10 years of taxes, you earn Part A. So a lot of times I get members who says, I just turned 68. I never got Medicare. Well, how long you been in this country? 5 years. Okay. Or I never worked in my life.
Right.
And so you never put taxes in the life. Well,
Right.
I was always paid,
Off the
through
books.
off the books.
Yeah.
My husband or my wife always works, whatever. You have that situation. Okay, so you never pay taxes. Yeah. If you're, it might be different rules when you're married. If you file taxes together,
Right.
that's a different issue. But yeah, so a lot of times if you don't put taxes in the country, you don't earn the Part
Right.
A. But again, you have to go through Social Security. There might be a way you might have to pay a premium for that Part A if you don't, because Part A is normally for free. But Part B always comes with a premium, but Part A might come with a premium. So I know people that pay for both because of those circumstances. So there's a way to do it, but you have to go through Social Security to ask if there's a way that you can do it. And then, or another way to earn it, you collect disability. I mean, that's the harder way. No matter what age, you have to collect disability for 2 years through Social Security. Once you collect this, no matter what age you are, I've had people who were 25 that collected disability for 10 years since they were teenagers. They qualify for Medicare. So they were able to get certain plans. And you get all the benefits with Medicare, no matter what age. So those are the 2 criteria.
Now, are those people still looking to buy supplement plans and so on, even at their age? There's no difference.
Yeah, there's no difference. Yeah,
Right.
you get treated just like you. Once you earn Medicare, you get all the
Right.
perks of what Medicare gives you.
Okay.
Yeah.
Interesting. This also, we discussed off camera about people collecting at a young age.
Yeah.
You think Medicare? You think 65?
You think old, you think 65, but no, there's loopholes, and that's one or 2 things you could earn it.
Right. That's very interesting. I did not know the 10-year rule. I probably should have known that, and I didn't know that. But everyone I know works for more than 10 years when they're 65.
Well, a lot of people don't know that because what happens, because I've gone through a lot of people, and they're mostly not from this country, and they don't know why they don't have Medicare. I thought,
Right.
well, I'm 75. How can I never have Medicare? Well, you have to ask questions. What's your situation in this country? And they said, oh, well, I came in this country, 8 years ago.
Right.
Oh, so did you put taxes for 8 years? Yes. So you have to put 2 more years
Right.
in taxes. Again.
That's a good question. I almost interrupted you. I'm sorry. But someone's in the country 8 years, doesn't qualify for Medicare. He works 2 more years. He's now, in your example, 77 years old. He can now enroll for Medicare without any penalty because he wasn't qualified at 65?
No, you're not qualified because you didn't earn it.
Right.
There's penalties if you qualify. You don't get it.
Right.
There's certain the only way you get penalized is if you qualified for a plan.
Right.
If you don't qualify for a plan, you don't get penalized.
So if you qualify late, you're not
If you
penalized for applying late.
Exactly.
Okay.
So what happens is once you qualify and you don't apply once you first qualify within a certain period of time,
Right.
then more likely you'll get
Got
penalized
it.
for whatever the circumstances might be.
So ding, 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 you've hit the trifecta. I learned 3 new things so far. My goal is to learn 3 things on a podcast, and we've done it already at this stage.
Yeah.
So, and I've interviewed other people do what you do, and I just learned my 3rd thing today.
Oh, that's great.
So there you go.
Yeah,
So
there
if
you
I'm
go.
learning 3 things, hopefully people out there are learning things too.
I hope so too.
So there you go. So that's interesting to know. So we have A, B, D, as we said, and the C is the private companies that are selling you that C, the advantage. And
No, well, C is the private company
Right.
that sells you the advantage. Well, C is always called the advantage plan.
Correct.
Or the supplement plan.
Or supplement,
But
right.
Part D you could get separately within the company.
Okay.
That provides it. So in
Okay.
other words, if you just want Part A and B, always have that separate Part D.
Right.
It's going to come with a premium.
Right.
But you have to have it no matter.
it.
Again, I reiterate this.
Right.
It doesn't matter if you take medication or not. If you qualify to get the Part D, get the Part D.
Right, right.
It's going to save you money in the long run.
Medication is so expensive.
It is.
I know that government's talking about that they're either doing work or they've done work or they're supposed to be negotiating right now. We'll see the results if they haven't happened already. I have very good insurance, so I don't see my medication I get free or $3. These silly numbers. I'll buy a bag of pretzels and a 90-day supply of one of my medications, and my pretzels are the big bill. So insurance really works.
Yeah,
So
it does.
That's important. That's literally what I do. I'll go buy 2 bags of pretzels and get my medication at the drugstore. I probably shouldn't be eating pretzels. One of my medications is high blood pressure, but don't tell my doctor. So anyway, putting that aside, the same problem. So I probably shouldn't eat pretzels with salt. But putting that aside, but I can eat them because I'm getting my medication to fix the problems I'm causing by eating pretzels. So this is not a medical show. This is not medical advice. So so anyway, but with that said, so. People are now buying that because they mix up the government portion and the private portion. And so often when we turn 65, we're bombarded, as you said, with ads. I'm going to say, what's the biggest scam that targets seniors during the Medicare enrollment period?
Well, when you have, so a lot of times, first of all, you have to understand that if somebody contacts you that you don't give permission with, they're not allowed to contact you. I cannot contact anybody that I don't have permission for.
Contact as a phone call?
As a phone call.
You can mail me.
I can mail you information.
Because I get tons of mail. I got tons of mail.
I can mail you information, but I can't call you and say, Larry, my name is Pierre Menard. I'm an agent. I'm looking, if I was calling in regards to having, you want Medicare insurance. You can say, Pierre, I don't know you. I didn't give you my permission to call.
Right.
That's more within your rights, and I don't want you to call. The only way I could do that is even you, Larry, says, Pierre, you could call me. I have to have written consent to say, okay, I could
consent.
Yeah, more often than not. You have it's just to say it's called a scope of appointment. So in other words, you sign that scope of appointment, you give me permission to call you and to contact you anytime. If I don't have that, if I have permission, I'm not allowed to call you at all. Even if you say, Pierre, I have a friend, my brother needs health insurance. He needs Medicare insurance badly. Okay, Larry, have your brother call me because I can't contact him. You're giving me permission. You can't give me permission to call him. He has to give me permission to call him. So that's the main thing. So that's where the scams come in. So if somebody calls you out of the blue, they don't know you're gonna call. You don't know you don't know who they are. You don't know where they got your information, and if they start asking you personal questions like what's your address, your phone number, your social security number, they'll ask you that.
I shouldn't give my social security number to strangers over the phone.
Nope.
Oh, thank you.
Oh yeah. Ding ding ding. That's a shocker, right?
Yeah.
There's certain if you meet that person in person, and sometimes honestly we need the social security number to get information to see where you stand.
Right.
So, but as a licensed agent, I cannot violate it. I can't show you your social security to somebody else just because you gave it to me, because I'll get in trouble. Right. So my license is in jeopardy if I do that. So I gotta tell you, look, this is between us. It's confidential. Right. I'm asking permission if I could use and the reason why I'm asking for social security is because I need to look up where your status is, and I need that information if you can't give me other information to give besides the social security. Right. But again, I get I get a little sensitive with that and tell you and to the privacy and understand as a licensed agent, you're safe.
Right.
And because I'll jeopardize my license, I can't do that.
They should be safe.
They should be safe, yeah. But you know what? Like you said, there's always scammers.
Right, there's always scammers. So if somebody wants a red flag for a scammer, it's someone reaching out to them proactively without them giving permission.
Yeah, that's the first red flag.
That's the first red flag. Second red flag, they don't know you at all.
Yep.
They haven't done any homework, and they're asking you for personal information.
Exactly.
And these people are not insurance people whatsoever. They're just scammers.
They're just scammers.
They're not insurance people trying to screw you over.
Yeah.
They're not insurance people at all.
At all, yeah.
And they probably come from another country, from somewhere else, calling you. Some back room in a sweaty shop, kind of thing.
And sometimes you got to, even if they're licensed agents, there's certain, everybody's human, even if you're a licensed agent, and you have to really be careful and kind of, if you're not comfortable with the question that they ask you,
Right.
it's okay to say no. I'm not comfortable asking that question. No matter if even for me, if they say, Pierre, you know what, I'm really not comfortable giving you that information. Okay, fine. I'll give you my information.
Right.
Here's my number. Once you're comfortable, when you feel okay, contact me and say, you know what, okay, I could ask these questions. Okay, great. So
a question I wasn't going to ask, it didn't occur to me, but it's occurring to me now, and that is, I'm in that situation. Pierre's sitting in my living room. He's asking me for my date of birth, my social security number, but I don't really know Pierre. Yeah. I'm not comfortable giving Pierre this information. Mm-hmm. He says, Larry, here's my phone number, my business card. Here's some information about the company and your options. Mm-hmm. You call me when you're comfortable. What am I doing in that time to make myself comfortable? Is there a registry I can go to?
Here's okay. For that particular scenario, let's say I am in your house and you're uncomfortable. Number one, you have to sign a scope of appointment that we made that appointment.
Okay.
In that scope of appointment, this is what we're going to discuss. So you know it in advance. Okay. So the fact that I'm sitting in your living room, more often than not, you're already comfortable with me because you already signed a statement saying, we set up this appointment. This is what we're going to talk about. Mm-hmm. And then, we get through the process.
Right.
Now, during that process, if things change and you say, you know what, I don't feel like discussing that. Okay, we could delay it. We'll sign, and then next time we'll sign another scope of appointment and we could discuss something else or something that you'll be comfortable with. But there's always consent. With that written consent about what we're talking about and why I'm here talking to you about talking about the plans that you need.
Okay.
And there's certain questions I may ask. I'll tell you in advance. There's certain questions I may ask, but one of the red flags that we mentioned is if I can't ask you health questions. I can't ask you, well, how's your heart feeling? How's your eyes? That's not my job.
Right.
I can only ask you if you volunteer that information. Okay, but I said, I don't need to know all that. I just need to know what doctors you see and what medications that you take. Right. And then I got to see if they're covered. That's all I care about. Right. So one red flag if they ask you health questions.
Right.
Because if I ask you health questions, that means I'm kind of screening you.
Right.
You know what I mean? They say, oh, you're not right for this plan. I can't do that. You know what I mean? I got to find out what's the coverage, and the only thing I can ask you is medications, and that's pretty much it.
Okay. So these plans are automatic, not automatic, are what's the word when you don't have to qualify? I had it a second ago.
Talking about the enrollment periods or just
not the enrollment periods. Anyway, that you like life insurance.
Yeah.
But like guaranteed issue.
Guaranteed issue. Yes.
So
no.
Then,
No. I think the difference is with this with health insurance is one particular. You have to just make sure it's all about saving money, right? So it's all about coverage. So my concern is when I sit down, I want to give you the maximum benefit with the least amount of out of pocket as possible. That's going to benefit you. And with that, certain questions I have to ask is how many medications that you take.
Right.
What are the milligrams that you take? I got to make sure. I got to see what tier that they go through, which means tier 1 is pretty much generic. Tier 2 is generic, 2 generics, tier 1 and tier 2. Tier 3 is brand, tier 4 is specialty, and tier 5 is a certain type of drugs, and tier 5 is a specialty drug, certain drug or a special drug. And each tier has a payment out of pocket that you pay for each tier. Mm-hmm. So that's all. I have to get that information so I can tell you, well, you're going to pay this, because it's the brand. It's a brand drug, so it's going to be more expensive than a generic drug. And that's all. That's as far as the health questions I will have to ask you. Right. I'm legally asked question. I'm legally allowed to ask you.
Right.
And then I go through your doctors. You see a cardiologist. You see a foot doctor. Who's your primary doctor?
So not why am I seeing a cardiologist, but am I seeing a cardiologist?
Are you seeing a cardiologist?
Got it.
Okay. Now that's a red flag. So why are you seeing a cardiologist? Well, I had surgery. That's not my business.
Right.
As an agent, that's not your concern. You just got to make sure the doctor that you do see is in the plan.
Hi, I'm Larry.
And I'm Ben.
We're the father and son team of Leave the Key Home Buyers, and we want to buy your house.
We specialize in working with seniors who are transitioning out of their homes and we understand what you were going through.
So if you're considering selling your home and would like an alternative to the traditional overwhelming process, reach out and see how we can help.
Do you have an outdated home?
No need to update anything.
Have a home that needs repairs?
Don't bother with repairs.
Don't want to take everything with you?
Leave whatever you want behind.
Dreading the headaches that come with agents?
Sell your home without paying a commission.
Dreading prying neighbors attending open houses and passing judgment on your home?
No need for public showings.
When you sell to us, you'll have all the certainty of closing on your timeline, not someone else's, and there's absolutely no pressure.
Visit leavethekey.com or call us today for a no-obligation offer at 631-388-7771 if you want to sell your home today.
So if I bypass surgery last year versus I'm taking a low-dose high blood pressure medication, it doesn't matter.
Not my concern.
Got it.
Not my concern. The only thing I'm concerned about is who you see, and it doesn't even matter how often you see. I have to see my cardiologist, and a lot of times when we deal with an Advantage plan and we go through the doctors, you have to ask all the doctors. I had people who sees 15 doctors, no joke.
Right.
And I have to make sure, and I don't want to change one doctor in this list of 15.
Right.
I got to make sure each and every one is within the network that I'm selling.
Got it.
Well, as a broker, I have different plans that they could. So I have to make sure I'm contracted 10 different plans.
Okay.
So I'm going to make
10
sure.
different plans? That mean 10 different companies?
10 different companies.
Wow.
Yes.
Okay.
So within that plan, within those doctors, I have to see which plan takes all of them.
Right.
Because if they don't have, because all of them are special to us. So that's my job.
Right.
To make sure that, okay, all your doctors in the plan. Because a lot of times I've had situations where they just give me their primary doctor and they'll see the foot doctor. Oh, but I forgot I have to see my cardiologist. I see him once a year.
Right, yeah.
And they're already signed up for the plan, but that cardiologist is not in the network.
Right.
So that's another problem.
Yep.
So
Yep.
and so that's why, I mean, some things are going to happen. You're not, you try to answer questions, ask questions, and you try to answer it to the best of your ability.
Yep.
You're not going to get everything, but it's my job to try to
Right.
ask as many detailed questions as I can so I can find the right plan for you. So
That's very important to know. So make sure when you're meeting with your Pierre, preferably this Pierre,
hopefully,
that you have a list of all your doctors and all your medications prepared for the appointment.
Yes.
I assume that's something you give them on the pre-list of things to do?
I give them my email address or text me and say, can you do me a favor? Before we even get into the plans, that's the first thing I ask.
Right.
Because sometimes I'll deal with kids.
Right.
Or my mother takes a lot of medication. Can you do me a favor? Text me before we get into anything. Text me all your mother's medications.
Right.
Text me all her doctors that she sees. And text me what hospital she goes to or what clinic she goes to normally. Because if she goes every 6 months, you don't want to change. So and from there, once I look up all the medications, I look up all the doctors. If it's a situation where I can say, okay, I got to look up which plans I have. So let's say I have 3 plans that take all your medications and all your doctors. Within these plans, you tell me which one is right for you. I think this one is good. It gives it. You don't have to pay a premium. You save a little money, but you're not losing any benefits, that type of thing. Or you have this. It may cost a little more, but you have perks with it. So from there, we discuss it and we find out what plan. I give them the flexibility to see that plan is pretty good. I don't care if I pay a premium. I say, okay, that's fine. And we take it from there. But again, the first thing I got to do is make sure that everything's covered. Because, Larry, I'll tell you, if medication is not covered,
right,
and they go with the plan that their medication is not covered, disaster. They have to come out of pocket $600-$700 for a 30 months, a 30-day supply.
Yeah,
it's going to cost.
That's devastating.
It's devastating. It's devastating. So that's why I'm very careful with that. So
I don't know if the donut hole still exists. My father was in the donut hole, if you remember
yes.
that.
Mm-hmm.
And I don't know if people aged out of the donut hole at this point. But my father now would be, 99 years old if he's still alive. I never thought about that. Anyway, but one of his medications cost him $5,000 a year. because he was in that donut hole and
Yeah.
it wasn't covered. What the donut hole is not really important. Again, I think I don't think it. I don't know if it exists anymore. But it. Thank God it wasn't devastating to him. He
Yeah.
could afford it. But
Yeah.
that's devastating to most Americans.
Yeah.
And most senior citizen Americans, especially. $5,000 a year, and he had to pay that for years. And he couldn't just say, no, I don't want the medication. He needed the medications, to stay alive. So, yeah, picking the right plan is important. But we said two things, and I want to make sure people understand those two things. So when you sign up for Medicare, and there's the government part and the private part.
Yeah.
Let's start with the government part. Once you sign up,
Yeah,
you're in a plan. And
you're in. You have Medicare pretty much. Once you earn Medicare, it doesn't go away.
Correct.
It's
You
very
sign.
rare. Yeah, so it's something that you'll always have. You might not use it in certain cases, but it's something that you always have.
Well, it's like auto insurance. You hope never to use it.
Yeah, exactly.
Right.
Exactly.
But you don't have to change plans or do any more homework on the regular government portion of Medicare.
Well, you should, but you should understand what it is. Like
Right.
when I explain the Part A and Part B, you have to understand what the functions are.
No, once
And
you
part-
sign up to it, once I'm now 70, am I looking at my government portion of my Part A and so on anymore, or just at my Part C and D?
Well, at that point, you're looking at once you shop around, you're looking at Part C and Part D. But you're looking at Part D is part of Part C.
Okay.
So you're looking at different plans. This is where you shop around a little bit to
And I
find
can
out.
shop around annually.
Yes.
Is my question.
Yes.
So the private insurance portion of this is something so if I make a bad decision in year one, I end up choosing a plan without my cardiologist in there.
All right.
I said, oh crap, or a drug plan without my drug in there.
Yeah.
I'm stuck for a year.
Okay. Nope. Okay.
That's
I'm
my
glad
question.
you asked it.
Okay.
Okay. So we have the annual enrollment period every
Yes.
year from October 15th to December 7th.
Yes.
So that gives you an opportunity to shop around for different plans. Before the 7th of December, you could pick and choose as many plans. You can even enroll in as many plans that you want to within that period. But once the last plan that you choose on the deadline is the plan that you have. Okay, so you're locked in. But a few years ago, they had a special enrollment period called the open enrollment period, which started maybe 5 years ago. They didn't have that before. So
I didn't know that. 'Cause
Yes.
I've been paying attention as I'm 68. So,
Yeah. So
okay.
the open enrollment period starts from January 1st to March 31st.
Right.
And this gives you an opportunity to shop around for plans if you're not happy with the plan. So just like you said, my cardiologist is not in the plan. Okay. So you have the open enrollment period to shop around again. It gives you a one-time opportunity to shop for another plan until the 31st of March.
Right.
Same thing. You could pick and choose as many plans you can enroll as many plans as you want within that period of time. But the last plan that you actually choose by the 31st is the plan that you're stuck with.
Right.
But open enrollment period is only for people that either chose a plan, an MA plan, or they stuck with the plan that they already have. It's not for people who have Medicare only.
Right.
So Medicare only is only for the annual enrollment period.
Right.
So the government gives you another chance to enroll in another plan in case the plan that you chose is not right for you. So that's another opportunity, and they just started that maybe I want to say 2017.
Okay.
Around that time, so it's pretty recent. So a lot of people don't know about that, and that's where I lecture all the time. That's why I do most of my presentations during those periods. To say, look, you still have another chance if you're not happy with the plan that you chose during the annual enrollment period.
So my birthday was May. So I had to assume my wife wasn't a school teacher. Well, I still had to sign up for my other portions anyway. So I now sign up in May. I have to do it by the time I'm turned 65.
Yes.
My first year.
Yes, the first year. Yes.
Right.
So once so your birthday's in May. So you have 3 months before you turn 65.
Right.
The month you turn 65, and 3 months after.
Right.
So that's 7 months.
That's a pretty big window.
Yes.
But people still screw it up.
People still mess it up. Yeah, exactly. So they have 7 months to choose a plan. Yeah. More often than not, you'll probably get a Medicare card the month before, or the month that you turn 65.
Right.
That's usually what happens. But you can't choose the plan. Like I can reach out to you like 2 months before you turn 65. Say, hey Larry, you're gonna turn 65 in 2 months. We can talk about plans now, or we can wait until April. So in other words, you could register for a plan in April, and you'll get the plan by May. Mm-hmm. Because on your Medicare card, it's always gonna say May 1st 2026 if you turn 65 that year, and that's when you register. Now, when you have Part B is a little more flexible. So if you already earned Part A, you turn 65, you Part A, and you have coverage like maybe through your spouse or through your job, you don't have to necessarily have Part B because Part B comes with the premium because the state wants to know that you already have access to a doctor and you already have coverage to see a doctor. So you don't necessarily need the Part B because B covers doctors, blood tests, those types, lab work, those type of things. But if you already have access or coverage for those, don't pay for the Part B just yet. That saves you $1,200 a year. So if 5 years down that line that your whatever plan that you had before cuts you off through no fault of your own, then you could call Social Security and say, you know what, I want my Part B, I'm not covered for a doctor. Then you could get the Part B and start paying for that premium. But if you have Medicare and Medicaid pays that premium. So a lot of people have full Medicaid benefits and have Medicare. You have to contact Medicaid to say, I just earned Part B. Is there a way that you guys could pay for it, and they'll put you through that process. A lot of people don't know that. So a lot of people don't know about, because we talk about Medicaid a little bit.
Right. I want to make a comment.
Yeah.
People confuse Medicare and Medicaid all the time.
Yes.
And I find I use them interchangeably, and they are very different.
Yeah.
It's just they sound so similar, I tend to slip. Can you just
I
please
flip too.
You slip too?
I do.
Okay.
Yeah, all the time.
Okay.
So Medicaid is a state plan where it only cares about income and family size. Doesn't matter how old you are. Before you turn 65, from 64 and below, there's a certain income level. I'm not sure what it is now. It used to be $1,500 a month. If you earn at less than $1,500, you qualify for Medicaid. That's mostly for people who don't work or have very low income. And then see how many people in your family. If you have kids, your wife, those are your immediate family.
Are assets factored into the equation or just income?
Just income.
Okay.
And so they don't care how much you spend. There's a lot of times where, Pierre, I pay rent, I pay this. It doesn't matter how much you spend.
That's right.
It's how much income you get before taxes, not even after taxes.
Oh, really?
Yeah.
Okay.
So.
Well, if you're making that little income, you're probably not paying any tax.
Exactly. Yeah. So then you earn Medicaid. Medicaid is a plan where, and sometimes with Medicaid you could go straight Medicaid, just like Medicaid, you go straight Medicaid, or you get Medicaid through a private company. The state usually encourages you to go through a private company because, again, you still have benefits with those plans, and it's easier to go through a private company and find out what's your coverage and what you're not coverage. It's very easy, it's very easy to go through a private company than through the state. Because you'll call an 800 number and talk to 8 different people about one question.
Yeah.
So, you might have the same experience with a private company, but it's easier because they'll know exactly who you are. You're in the system, and it's easier to contact somebody from there. So, what happens is once you say a person has Medicaid, and then they turn 65 and still have Medicaid benefits. So the state is like, for the Medicaid, you don't need Medicaid. Because you earn Medicare, you have Medicare benefits now, so you don't need us because the state doesn't want to give you free benefits for no reason. So, but the loophole is let's see what your income is. If your income, like I said, $1,500, that's just a rent. I'm not saying that's what it is now.
Right. It's not a lot.
Let's say it's $1,500.
Especially as New
so
Yorkers.
your income is less than $1,500. Let's say it's $1,300. So you have to earn $1,300 a month to get Medicare and Medicaid. That means you're in a certain low income cycle that you say, okay, you need our help. So that means you have Medicare and Medicaid. So once you have that, all these private companies are going to give you additional benefits at no cost. No premiums, no copays, no copays for hospital stays, blood tests, lab work. That's all going to be covered by Medicare and Medicaid. And private company, whatever companies go to.
That's the good news. The bad news is you're poor.
Right. Exactly. So a lot of times, Larry, I get people telling me they get mad that, oh man, I can't get Medicare and Medicaid. I'm like, that's good.
That's right.
That means you're making some money. So you don't want to be in a position financially that you can earn Medicare and Medicaid, even though you get these perks. There's a reason why you get these perks, because you make and a lot of times you can't, where you physically can't work.
Right.
So that's why they say, okay, you're in a certain income level, you get Medicare, Medicaid. These private companies say, okay, this is what your perks are, and that's part of it is the over-the-counter card, the OTC card. People love the OTC card. That's when you could buy vitamins, aspirin, cold medicines, and a lot of times you could buy groceries with it. You could pay bills with it, and now this year, to buy groceries, you have to have a chronic condition. That means if you have a heart problem, you have diabetes, you have arthritis, you have high blood pressure, things that qualify as a chronic condition, you can buy groceries. It usually helps them a lot. So
the OTC card means you get these things at a discount?
No,
it?
no. Well, the company that offers the OTC gives you a certain amount every month. So some plans will offer you maybe $500 every 3 months, or some plans will offer you $200 a month. So that goes towards the blood, the groceries or bills or over the counter like cough medicine and things like that. So that saves people a lot of money in the long run. They use it at a discount. But again, this year it's you have to have a chronic condition to buy groceries, but we encourage buying healthy foods.
Right.
To get them, because we want to encourage health, we want to encourage checkups, we want to encourage all that. So the more, and insurance companies love checkups every year, because the more you check up, the more you're keeping up with their health, the less obviously insurance companies have to pay. Mm-hmm. So they really encourage. That's why you don't come out of pocket when you just do an annual checkup. So,
but it's funny you say that, because I go to a chiropractor.
Mm-hmm.
And my Medicare is my primary, and for years he's been begging me to come back monthly.
Yeah.
And he'll keep me in good shape. And I wasn't doing that because I'm kind of a stubborn guy, and I'd only go back when I hurt myself, which would be every few times a year. Mm-hmm. It could be just literally turning to talk to you. It doesn't take much. Mm-hmm. And then I see him typically 4 or 5 times a week for 3 weeks. And then taper down from there, and then finally I'm better again, and then a few months later it happened all over again.
Yeah.
So I'd see him 25 times a year by not going monthly.
Exactly.
And he says, but the Medicare doesn't want me to go monthly because they don't want to pay for that. Even though it's cheaper than to pay for me to go monthly than to pay for me to 12 times than 25 times.
Well, a lot of times that's true.
Yeah.
But, again, the reason why you don't come out of pocket in those checkups is because the company's going to pay. I mean, doctors. I'm not saying doctors encourage you because they want to keep you healthy. Yeah. But they know they're going to get paid by the insurance company, so that's part of it. Yeah. And a lot of the times that doctors take plans or don't take plans, it's usually financial. It depends. Yeah. Some companies don't pay quicker than others, and it's at the end of the day, doctors it's a business. At the end of the day, they got to get paid, and they got to get compensated, and they have to get compensated through the insurance companies.
Yeah, my $6 copay doesn't cover it.
Yeah, exactly. Yeah, exactly. So, and sometimes you don't pay a copay in certain cases. Yeah. That means it's more important for them to get money because you're not getting to pay. But we're talking about lab work, blood tests, all that stuff. That's costly. But if you're covered by the insurance agent, that's even better because it encourages you to say, I have to see my doctor at least every 6 months, at least a year. Yeah. Do that. Keep up with your health. Keep up with your take advantage of coverage that you're not paying for.
Right.
Because at the end of the day, if you have a heart problem, you have to come out of pocket for copays. They might catch something that could have been worse if you didn't go to the doctor. Right. So that's what insurance companies encourage, and that's why I said, look, you could do telehealth, you could do it through telehealth, whatever every 6 months, every 8 months or whatever. But again, if your doctor's telling you to see you every month, there's a reason why to do it. But if it's already covered, great. Right. And sometimes these insurance plans cover flu shots, every year annually. That's already covered. Take it, because again, it's gonna protect you in the long run.
Yeah, so that's a whole nother discussion. Yeah, for those days, flu shots and COVID shots and so on. We won't get into that part. Yeah. Neither of us are doctors. Yeah, but putting that aside, nope. I don't want to be. Mm-hmm. I don't even like getting an injection, let alone giving one. So the question for you: is there ever a time that you sat down with a client and you've saved them thousands of dollars?
Well, that instance I was telling him about. Oh, well, two things. Well, about the Part B.
Yep.
They said, well, I'm paying to my Part B plan, and I have coverage through my wife or through my job, and said, so why are you paying the premium? Because you already have access to a doctor.
Right.
That's going to save you $1,200. Oh, really? Oh, okay, because
Right.
they think it's automatic. So no, this is paying the premium for Part B is not. You don't have to do it if you have access. The only reason why you have to do it is because you have to get it. You have to get Part A and B to get the Part C, or
Right.
when you have Part D, you don't even have to. If you even have a separate Part D plan, you don't have to have both A and B. You could have either one. You can have Part A or Part B,
Right.
to get a Part D plan. But yeah, in another case where we talked earlier regarding that 1% of not getting that Part D,
Yes.
I said get it right away because it's going to save you money in the long run. A lot of people don't know that, So I think in most cases is well, it's when I say you're already covered with a Part B, I mean I lose a client because they don't
Right,
need
correct.
it. But again, I save them money. But
Right.
part of my business, what I try to do is build trust.
Yeah.
By telling them, because I go with the philosophy that if my plan is more important to me than it is to you, then it's not worth it.
Yeah.
I want the plan to be just as important to you as me giving you the plan. So, or even more important.
More important.
Because, I can't push a plan that you're not really, even if I feel that is right for you, because just because you tell me your circumstances, I really think this plan might fit what you're looking for. If you're kind of like on the fence, or I don't really, I don't really believe that it's for me, then okay, call me when it's ready. Call me when you're ready. But this is what it is. But there are other options that you could look at. But I try to build through that trust, and then ironically, they'll call me like a week later, or sometimes they'll call me soon and say, you know what, you were right. Let them let the person. I've let the person think about it, because health insurance is not something I play games with, because this is somebody's health, this is somebody's cost, this is somebody's. So if I miss anything, even if I miss a medication that they take, and they're locked into a plan, then it's my responsibility because I didn't look into it.
Yep.
I didn't do right by them, even before I get into the plan. So I tell clients this before anything. When I do my presentations, I say the first thing you can look at is your doctor. If your doctor is important to you, or there's certain doctors that are important to you, make sure they're in the plan that you're looking at. Your medications. If you're overwhelmed by your medications, please have family members look at it. Even me as a broker, I'll look into the medications for you, because I have access to look it up to see, how much you're going to pay out of pocket, and I gotta make sure you give me all your medications, and I'll make sure that I said, are you sure this is it? You say, yeah. And at the end of the day, if I miss one, then because I don't want them to get locked into a plan, to wait another annual enrollment period, because sometimes you don't qualify for certain enrollment periods, so, and I don't want them to get locked into a plan that's not right for them. So I'm really careful about that.
So I'm going to ask you my next question, but you just answered it, and that is, if someone to listen to this podcast and have just one takeaway, what would it be? And I think you kind of answered the question. But
Always be on top of your insurance plan,
Yep.
no matter what. If you're always have somebody involved in your family. If you have kids, grown, adult kids in most cases,
Yes.
get them involved. Let them know what's your coverage, because you can't do this on your own. Especially with, look, I've been doing this for 14 years, and it gets overwhelming for me. And I'm on top of it every year. There's
Right.
certain things I might miss. So I would say know what you have, know what you're getting. Always be on top of your insurance plan. See what you're covered, what you're not covered for, and then and just ask a lot of questions. No matter how big, ask a lot of questions about your plans. Always get up to date with the changes that's going on every year, because the plan that you have today might not be the plan you have next year.
Right.
So don't get too comfortable yet. Just know what you have and know what the changes coming up.
Yep.
And just ask the questions, because a lot of times there's certain scare tactics that people use that say, well, I heard from my cousin's neighbor that something's going to change. Don't say that. Don't take that as fact. Just make sure that the information is getting is correct, and always talk to an agent because we're trained we're educated to know to qualify you and what you qualify for, what you don't qualify for, what's going on, what the changes going on, what change is not going to go on for 5 years that you don't have to worry about right away. So I always tell them just be aware, just be aware, and again there's certain don't. And I said this, I talked about the OTC card, and from my experience, when I talk to members, that's all they care about is the OTC. They don't understand that OTC, and this is why I save them money again. Yeah. OTC comes with a package.
Right.
It comes with the dental plan, the hospital plans, prescription. You have to get the whole thing. OTC is just a perk.
Yes.
So even if, like I mentioned, they give you they give you $200-$300 a month in some cases. And that's all they look at. Oh my God, you give me $200 a month. but they give you $200 a month for a plan that doesn't have your cardiologist.
Right.
You know what I mean? So it kind of negates the whole purpose. You gotta look at it as a perk.
Right.
And not something that you have to look at.
And it's the whole package, as you said. That's the proper word. So
yeah.
How much money is the whole package going to cost? What's your medical care going to cost you a year with this package versus this package?
Exactly.
It's not any one component.
Exactly.
That's perfect. That's perfect. So question, Pierre, how do people get in contact with you?
You could call me directly at.
So they're allowed to call you.
They call me directly,
but you can't call.
I can't call them. Exactly.
Right.
Thank you. I'm glad you were listening, Larry.
I try every now and then. I'm thinking of something else, but I caught that moment.
So you can call me directly at 917-860-5046, or you can email me at Menard, MENARD 28 @gmail.com. You can contact me, and that's the best way to get in contact with me.
Perfect.
Yep.
Wonderful. It's such a pleasure having you today.
Thank you, Larry. I really appreciate the opportunity. I hope to do it again.
I hope everyone learned something.
I hope I did. I hope you learned a little bit. And again, there's always something to learn from this. And again, changes come every year with Medicare. So, if anything changes come in, you want me to come back, I'll be more than happy to.
Thank you so much.
All right, appreciate it. Thank you.
Thanks for listening to this episode of the Unlocking Senior Resources podcast by Leave the Key. If you've enjoyed this episode or found it helpful, don't forget to subscribe, leave a review, and share this podcast. We specialize in working with seniors who are transitioning out of their homes, and we understand what you are going through. So if you are considering selling your home and would like an alternative to the traditional overwhelming process, reach out to see how we can help. When working with us, you can sell your home in its current condition, there is no need to remove unwanted items, and you control when the house is sold, along with so many other advantages. Visit leavethekey.com or call us at 631-388-7771 to learn more about our senior home buying process.